Hello. I wanted to do some videos on the recovery of an ulnar osteotomy with ulna shortening. I think it's ulna, not ulnar shortening. I'm not 100% sure. But basically, what I got diagnosed with was my ulna bone was too long. I was born with it too long. It's always been too long, and the ulna bone is this bone right here on the side of your arm, right there, from your elbow all the way up to your fingers. Anyway, my ulna bone was too long, and tons of people have this problem, and I have only seen a couple of recovery videos on YouTube, so I wanted to do one that was just more recent and tell everybody my experience with it. I had this surgery yesterday. So anyway, my doctor at UCSF diagnosed me with the ulnar impaction syndrome. What made it way worse was, even though I was born with it and it's always been too long, I fell on my rollerblades about September of 2020. And it made it way worse. So the bone totally squished my TFCC tendon, and your TFCC tendon is right here at the top of your wrist. And the ulna bone kind of goes right up to it. So the bone's already too long. And then when I fell on my rollerblades, it just totally squished that tendon. I honestly don't even know if there's damage to the tendon right now. That's something that the doctor said he's going to look at more later. So the team of doctors came in at my UCSF appointment. I had about 4 of them in the room, and they all checked out my wrist. They messed with it a lot. It hurt because I've been having pain probably for about 2 years total, but it's been on and off. But when I fell on my rollerblades, the pain became constant. And I have a business and I work with my hands a lot, so I just wasn't able to handle it anymore. The pain was just too much, too often. So that's when I finally went to UCSF to a hand surgeon. But the doctors all agreed that I had ulnar impaction syndrome. They showed me an x-ray with the measurements of my bone, and I will show that x-ray. I think I can do it right now. Let me I can't flip my screen right now. So that is my right wrist, and you can see that the top, he made 2 pen marks on there. The top pen mark is supposed to be aligned with the bottom pen mark. So my bone is supposed to be, a lot shorter than that. Actually, I guess not a lot shorter, but he said he removed about 3 millimeters of bone. So that's basically, how long my bone was. So the doctor showed me, the x-ray, and he showed me how much longer the bone was. And he's like, it doesn't seem like it's, too much longer, but it does make a difference. And he recommended the surgery. The other thing that I have wrong with my arm is cubital tunnel. And cubital tunnel is where my ulnar nerve is damaged. And the ulnar nerve goes from like my neck all the way down to my fingers. That one is also getting squished and is moderately to severely damaged per the nerve doctor that did the test on my arm to see how bad the ulnar nerve was damaged. She did she put needles in my arm, and she put almost like a TENS unit on my arm to make my muscles go crazy so she could see on her sonogram how bad the nerve damage was. So that is actually a second separate surgery, although some doctors do it at the same time as the ulnar impaction syndrome surgery. It's called an ulnar osteotomy is what my surgery is called. But some doctors do that and the cubital tunnel surgery at the same time. But my doctor wanted to do the cubital tunnel surgery later. He didn't want to do too much to my wrist at once. And because he's a UCSF specialist, I really trust him. I live in the Central Valley in California, and I don't trust a lot of doctors around here. But I've gotten a lot of really positive treatment and vibes from the UCSF doctors that I've been going to for, medical stuff. So I really like them over there. And my insurance covers it, so I'm like super lucky. But anyway, he told me that I'm going to do my cubital tunnel surgery later and that my TFCC tendon might need to be worked on, but we don't know right now. He wanted to shorten the bone first and then see how the TFCC tendon healed before he sort of figured out if he needed to do anything to that tendon to fix it. So I had my surgery yesterday. It was scheduled at UCSF at 9 a.m., but I didn't end up having it till 12 p.m. because they had another case before me and it ended up going like way late. So basically I checked in and I went to my pre-op room. They started an IV. They asked me all kinds of questions about, my health and history and all other fun stuff and medicine questions and things like that. And then they put me in another pre-op room, so where I had a bed and I had a warm blanket. And I told them that I had some stress and anxiety and I was really nervous. So they gave me Versed and it really calmed me down. It really made me feel like, it was no big deal. And I was really super friendly with all the nurses and just laughing and joking with them. Only problem was it totally wore off because they gave that Versed to me at like 8:30 and I didn't have my surgery until noon. So they ended up having to give me a second dose of Versed. So anyway, they gave me that dose of Versed and then they did a nerve block on me. The anesthesiologist came in and it was a special anesthesiologist. It was a different one that was in my operating room. So the anesthesiologist comes in and he tells me he's going to do a nerve block. He gives me the Versed. And then he does like a sonogram on my neck area. You can see where this tape is on my neck here. And you can see where this wire is coming out. He does a sonogram to look and see where, I guess, my muscle is or my nerves are. Then he gets a needle, and I'm not going to tell you how long it is. I'm assuming it's pretty long. I didn't look at it because I did not want to see what was going into my, neck, chest area. My throat is sore, so I have a lozenge in my mouth. Sorry. But anyway, he goes and he puts a needle in my, neck, chest area here. And he goes kind of far down with it because he has to put in a catheter. So he puts a catheter way down in there and then he puts medicine in there because my arm started going numb almost immediately. This nerve block lasts about 12 to 15 hours. It's to help with the pain after this ulnar osteotomy surgery. And then they sent me home with a pain pump to continue the medicine in this catheter for about 3 days before it empties. And I'll show you that. So after the surgery, they gave me a little bag. So you can see here that this catheter is in my skin. It starts kind of up there. And then it comes out of my skin and goes down into this little hook here. And that's where it kind of like gets put together. And then they give me a bag. And inside this bag is it's a hard ball of medicine. So this hard ball of medicine has it's numbing medicine. And it kept to carry this around everywhere for about 3 days. And it slowly gives medicine into the catheter to keep my arm relatively numb for about 3 days. Once it's empty, then I can throw it away and I can take out the catheter myself at home and then just deal with the pain after with pain pills. So anyway, they take me into surgery. They put the oxygen mask on me. They then tell me that they're giving me the sleeping medicine and they put it in my IV. Nothing hurts. I don't remember anything. I just remember all of a sudden being awake and then being shaken awake after surgery. When they woke me up after surgery, I was not nauseous or anything like that. I just kind of was really groggy. I've had a few surgeries before and I never threw up or anything after surgery or got nauseous from the anesthesia. Anyway, they woke me up. I was super tired, super groggy, and there was a pretty good dull ache going on in my arm. And I woke up with this soft cast around my arm. But I was still pretty numb from the nerve block catheter. So all I could feel was like a little bit of a dull ache. And then they taught me how to use this pain pump here. they told me that, it was going into my skin and that I just needed to carry it around. And this actually came apart. This little white wire here came out of it because it's not that like sturdy. But my husband was able to clean it with alcohol and just put it back in and snap it back into place. It was really easy. And UCSF called me today and they said that was totally fine, that sometimes it comes out. I'm pretty sure that the nerve block medicine ball thing is working. It's called On-Q is the brand, ON-Q is the brand of this medicine that UCSF uses to give to people after these really super painful surgeries. Pretty sure it's working because on my way home from the hospital, it came out, that little white wire. It came out. I didn't notice it till I got home, and then my husband put it back in. But then about like 30 minutes later, my arm started hurting really, really bad. Pain was like a 10 out of 10. I took an oxycodone, which I don't like taking because it makes me really kind of loopy and tired, and I don't know. I just don't like taking narcotic pills. I mean, they work really well, but I just don't like the side effects of them. So I took an oxycodone and it helped a little bit, but not that much. And the pain was pretty intense. I remember crying last night when I went to try to go to the bathroom. My husband went with me because I had to carry this pain pump. I cannot lift anything with this arm. It hurts pretty bad when I try to lift or, do anything with it. And they told me, do not do anything with this arm for a while. So, yeah, the pain was pretty bad without this pain pump. Once the pain pump started kicking back in again, the pain got pretty dull again, and it's manageable. I just use, like right now I'm on Tylenol and ibuprofen. So if you can, suggest to your doctor to get this pain pump and get this, nerve block before surgery, I would suggest doing it. It was pretty beneficial. So anyway, the instructions after surgery was to stay still. Like I have this sort of soft splint right now on my arm. After a week, I go back on Thursday because my surgery was yesterday. I go back on Thursday and get a hard cast. And it's not going to be a full like over the elbow cast. It's just going to be the same length as this one. They did a pretty good incision in my arm when they did the osteotomy, when they cut out a piece of my bone to make my bone shorter. And then I'm sure by the time you're watching this video, you know what they're going to do. They saw your bone pretty much in half, your ulnar bone or ulna bone. They take a piece out of it and then make it shorter by attaching a plate to the bones to put them back together with a bunch of screws. So yeah, it's a pretty major surgery on your arm, but they deemed it necessary and I was in a lot of pain. So I just wanted to get it over with. Anyway, they're going to put a hard cast on me. They actually were going to do like a custom splint for me, but I will not stay still unless I have to. I'm really bad at not listening. I don't like sitting down on the couch. I like to be busy with my business and things like that. So when I told the doctor that, he goes, well, then we're going to put a cast on you, just like a regular old hard cast. That way it'll prevent your arm from getting injured while you're healing. And I agreed with him. I feel like I need something like that to keep me straight. But it was just going to be a splint. So I am going to have to watch it when I'm taking showers, which is why I got my hair braided so I don't have to deal with, washing my hair for a little bit. And hopefully I can just take a bath and protect my arm. So today is day 2 after surgery. The pain is completely manageable, I think only because of this pain pump that I have. My fingers aren't numb anymore, like when they gave me the nerve block, but they said that this medicine in this bag is not going to be nearly as strong as what they gave me in the hospital. But it's strong enough because my arm is not hurting nearly as much as it was last night. I'm a little bit scared of when this thing runs out of medicine. It's about 3 days after surgery when this runs out, and then I have to switch over to pain pills again. I'm a little bit scared on what that's going to be like, but I will update with a second video when I get my cast on and tell you guys how my pain is and what the cast feels like and things like that. But for right now, I'm pretty comfortable and I'm not doing anything except sitting on the couch, and I'd have to do everything with one hand for a while. And I do have to do exercises. They sent me home with an exercise pamphlet, so I have to open my hand and close it. And that is painful, but not too bad. To do this about 10 times an hour, and then I have to bend my elbow all the way out and in, and that's kind of painful, but not too bad. So I have to do that to make sure my muscles don't, fall asleep. So I will be updating in a few days with a new video on how I'm feeling and how the pain is after this nerve medication is done, and then also how it is to get a cast on.